Welcome to the series seminar video tutorials Germanische Heilkunde by Dr. Ryke Geerd Hamer, MD. My name is Helmut Pilhar. I am the father of Olivia, and Dr. Hamer's appointed lecturer on Germanische Heilkunde, Geerd. Understanding the basics is essential for the comprehension of Germanische Heilkunde, GHK, and important for the beginner and advanced student. By understanding the basics, you will have the necessary and solid foundation for studying the following SBS of the organ level, and the psychoses and constellations. Without a solid foundation in the basics, you will have difficulty understanding the following organ level, SBS, and the psychoses. Therefore, we offer the 14 basic tutorials in a complete package for a particularly favorable price. Each of the 14 packages consists of a video, an ebook, and an MP3 audio. Furthermore, every student who has purchased the complete basics package will receive their access link to a special study group on the internet, Study GHK Basics. You can ask me your questions personally about the GHK Basic and exchange with other students. This way you can also participate in the questions and answers of other students, to complete your GHK knowledge. Because of my personal destiny with my daughter Olivia, I have made it my task, to bring you, dear friend, closer to the Germanische Heilkunde. I have been following this duty since 1995. In general, I am considered to be a Hamer loyalist. I do not want to skip or conceal anything important in my explanations, and I also do not want to add or reinterpret anything. I intend to pass this information to you, as well as I received it from Dr. Hamer. In this introduction to Germanische Heilkunde, I hope to captivate and inspire you, to never let go of it. The intended goal in Germanische Heilkunde is always the spontaneous healing, which cost nothing, and have no side effects. For this to happen, the patient must be able to play his or her primary role. Ignorance, as well known, does not protect against the law of nature. Both the patient and the therapist must understand these biological correlations. The cause of the diseases that arise of their own accord is monocausal, the biological conflict. At the moment of the conflict shock, we associate. This associated conflict content determines the localization of the Hamer focus in the brain, and thus the organ disease. These biological conflicts are archaic conflicts, such as conflicts of morsel, disfigurement, self-value, separation, and territory conflicts, which are equally valid for the animal. To be able to understand this conflicting content, medicine must be understood from the history of development. Only then does a natural logic and biological sense of the various so-called diseases emerge. Nature does not do anything good or bad, but always only something sensible. To know the biological handedness is at least as important as to know one's biological gender. The handedness can be determined with the help of the so-called clapping test. The biological handedness indicates the partner and mother-child side, and never change in life. The objective of this seminar tutorial is to understand: why does the affected person always have symptoms on one side of the body, and not on the other? What determines biological handedness? What distinguishes left-handed from right-handed people? How can you still find out the biological handedness if the clapping test fails? What about the footness or eyeness? What influence do hormones have on biological handedness? Learn more about this in the 1.5-hour seminar video. This seminar video is about the first biological law of nature, also called the Iron Rule of Cancer, IRC. The Iron Rule of Cancer describes the monocausal cause of diseases. The cause of those diseases that arise by themselves. Cancer, allergy, chronic conditions, and psychosis is monocausal, the biological conflict shock, the Dirk-Hamer syndrome, or also called the DHS. The DHS is the linchpin in Germanische Heilkunde. It is about biological conflicts, and not about psychological problems. The difference is clarified. The first biological law of nature is considered generally accepted. The objective is to learn to understand what is meant by a biological conflict. You will learn more about this in the approximately 2-hour seminar video. Using several sensible biological special programs, we will discuss the Hamer's compass, synchronously on the 3 levels: psyche, brain, organ. The conflict, the active phase, the solution, the healing, the crisis, and the end of the healing phase. The individual, the inseparable, is an indivisible unity between the psyche and the organ level. There is no organ disease without a correlation in the psyche, and vice versa. A medicine that does not consider this inseparability is piecemeal, unscientific, and belongs to the past. We, in Germanische Heilkunde, have a third level, the brain level, with a Hamer focus in the brain CT. The biological conflict shock, the DHS, the cause, immediately leaves the Hamer focus in the brain. It can be photographed immediately. Until the organ symptom, on the other hand, is noticed, a certain time can pass. If we know one of the three levels, we know the other two levels. Several case studies illustrate this. To us medical laymen, the brain level is closed. Who can read a brain CT? But nobody knows our organ level and our psyche better than we do, and they always proceed synchronously. The objective is to learn to understand the organ level. No pimple without corresponding defilement conflict. And the pimple is already the healing phase. You will learn more about this in the approximately 2-hour seminar video. The Hamer focus in computer tomography is the proof that the biological conflict, the DHS, is the cause of the various diseases. The established system likes to deny this fact and reinterpret the Hamer focus as an artifact. In the healing phase, edema is deposited in these brain relays, interpreted as a brain tumor in conventional medicine. However, there is no nerve cell division after birth. We also find this Hamer focus on the organ level, on the skin, and even at the leaves of plants. A look into the brain CT is a look into the depth of the soul of the human being. One can see precisely where the problem is hidden. And since Germanische Heilkunde applies equally to the animal, we now also understand the language of the animal. The objective is to learn to understand why X-ray imaging is needed, and not magnetic resonance imaging, MRI. And to distinguish between a Hamer focus and an artifact. But what will you do if the intracranial pressure gets too high? You will learn more about this in the approximately 1-hour seminar video tutorial. In this seminar video tutorial, the brainstem is discussed. Here we are talking about morsel conflicts. The special programs involved are the gastrointestinal tract, lung alveoli, liver parenchyma, prostate, etc. Germ layer-related programs have germ layer-related brain relays, and thus also have germ layer-related crises. Thus, the crises of these special programs are so-called brainstem crises. One is cold, that's all it is. The cerebellum is discussed. Here it is about the violation of integrity. That is attack, defilement, and disfigurement conflicts. With the cerebellum, however, also the first social behavior was programmed in, the worry or the dispute conflict, concerning the mammary glands. The involved special programs are the dermis, peritoneum, pleura, pericardium, and also the mammary glands. The crises are the cerebellar crises. One is cold and has the typical cerebellar pain in the healing phase. The cerebral medulla is discussed. This is the seat of self-esteem. The special programs involved are bone, jaw, dentin, cartilage, tendons, connective tissue, adipose tissue, musculature. The crises of the cerebral medulla are also inconspicuous. One is cold. Our most complex brain is developmentally the youngest brain, the cerebral cortex. Here it is about separation conflicts and territory area conflicts. The special programs involved are the outer skin, bronchi, larynx, the coronary arteries, the hepatic bile ducts, the urinary tract. The functional failures like diabetes, paralysis. The striking crises are those of the cerebral cortex. One is cold, and in addition one has the absences. The epileptic seizure, the migraine. Here we also find the classic heart attack and pulmonary embolism. You can learn more about this in the approximately 1.5-hour basic seminar video tutorial, Brain Relays, Brain Map. This seminar video is about the tracks. Everything that is chronic happens via tracks. The track is basically the allergy. And just as one is allergic to grasses with conjunctiva, one is allergic to the workplace with colon cancer, for example. As long as one cannot resolve the conflict, the track causes a recurrence. If the conflict is resolved, the tracks dissolve. The goal is to understand that every track allergy originates in the DHS, which is the biological conflict. Without a track, there is no chronic epilepsy, Crohn's disease, acne, arthritis, dandruff, athlete's foot, and so on. You can learn more about this in the approximately 2-hour seminar video. Tracks cause the various chronic courses of conflict. Thus, for example, a motor conflict, monocyclic causes in the crisis an epileptic seizure, tetanus. In the polycyclic course, epilepsy, or the tic. In a hanging healing Parkinson's disease, Huntington's disease, tremor, and hanging active, a paralysis, or stroke. But the cause of all these symptoms is and remains the motor conflict. We can get with any SBS into these different chronic progressions. This seminar video tutorial will also discuss which conflicts are better not to resolve, because we cannot survive the healing phase. The objective is to learn to understand that we can reduce the clinical dictionary's Cerebral to the scientific diagnosis chart of Germanische Heilkunde. You can experience nature, but you have to believe in the swine flu listed in the Cerebral. You will learn more about this in the approximately 1-hour seminar video. This video tutorial is about the second and the third biological laws of nature, the law of the two-phase of all sensible biological special programs, provided the conflict can be solved. But what if we cannot resolve the conflict? How do we actually solve conflicts? This second biological law of nature is considered to be generally accepted. The third biological natural law is the ontogenetically conditioned system of the sensible biological special programs. Which programs make cell proliferation, cell loss, or functional failure? The gullet mucus pattern and the outer skin pattern are explained in detail. This third biological law of nature is about to be generally accepted. The objective is to recognize that if the conflict, the DHS, which is the cause, is known, we can remain in control of our own personal affairs. Often only common sense is needed. We recognize that all special programs are not related to degeneration, but run according to natural laws. You will learn more about this in the approximately 1.5-hour seminar video. This video tutorial is about the fourth and the fifth biological laws of nature. The fourth biological law of nature, the ontogenetic system of microbes. The topics discussed are vaccination, immune system, contagion, epidemic. Which, from the perspective of Germanische Heilkunde, turns out to be superstition. The fifth biological law of nature, the law of understanding any so-called disease, as a part of a developmentally understandable and sensible biological special programs of nature. The quintessence. It heralds a paradigm shift in medicine. Where do we have to start therapeutically? With the symptom? Or with the cause? In nature, good versus evil does not exist. This division is religiously motivated. Nature always does something meaningful. The objective is to understand symptoms such as pulmonary tuberculosis, night sweats, body odor, sagging breasts, hypothyroidism, drying up of salivary fluid, cellulitis, scar keloid, lymphoma, and so on. We can lose the microbe phobia and the fear of cancer. Not by faith, but by knowledge. You will learn more about this in the approximately 1.5-hour seminar video. The therapy of Germanische Heilkunde is a causal therapy. As it is well known, the individual can heal himself only by eliminating the cause. From case to case, however, an emergency intervention by conventional medicine is necessary. The pivotal point is the biological conflict shock, the DHS, Dr.Hamer syndrome, which is the monocausal cause. We are working with the three levels, psyche, brain, and organ, to identify the DHS. Only when we know what the cause is, can we proceed causally. How great would be the successes of Germanische Heilkunde? Also discussed is the song, Mein Studentenmädchen, the second pillar of Germanische Heilkunde therapy. The objective is to learn to understand what therapy actually means. There are thousands of different therapies, all over the world. Everybody has his therapy, but nobody knows the cause of the disease. A notice, I am not a therapist. At the moment the motto because of the current system is, get it yourself, or stay in conventional medicine. You can learn more about this in the approximately 1.5-hour seminar video. Conventional medicine admits that it does not know the cause of any disease, so its therapy is inevitably experimental. Can cancer be inherited? Are there any carcinogenic substances? Can diet, not smoking, and exercise protect you from cancer? Has conventional medicine really increased our life expectancy? What does conventional medicine think about metastases? What does conventional medicine know about the causes of cancer? Where does it get its knowledge from? From statistics and animal experiments. Is it a science at all? Where does chemo come from? The fatal effect of morphine. What does the shock of diagnosis do to the patient? The objective is to understand where conventional medicine gets its knowledge from, and from which considerations it acts. A notice, I am not a therapist. At the moment the motto because of the current system is, get it yourself, or stay in conventional medicine. With this seminar bundle, you will have the complete fundamental knowledge of Germanische Heilkunde. It will enable you to understand nature's biological language, and you will learn to think biologically. With this, you are ready to study the various special programs of the organ level, and the psychoses and constellations that follow. Make Germanic your hobby and learn it as long as you are healthy. Then never again will a doctor nor a drug stand between you and your health.